Are we, wait, do I have to admit? Yes, I'm admitting. Oh, again. Is everybody on and available?
Not yet. So I think it's just my school and not East this period. And my students are just coming in.
Oh, good. Okay. You'll let us know when you guys are ready, right?
Need 3 minutes.
Excellent. Okay.
You guys can put your camera on and say hi real quick, but then you're gonna turn it off and make it. Okay, Chromebooks up. If you can't find the link, let me know, but it's on the calendar.
Hi.
And turn your, mute your stuff. How you get? Okay, we are ready. Thanks.
Excellent. So nice of you to invite us today. We have many more people joining. It's really, I'm still like, if you hear me pause and make funny sounds over here, it's possibly because I'm trying to admit people and also let people tell me the things that they have to tell me on chat. So thank you for your patience with me on that. And thank you very much for inviting us here today. We're really excited to be here. We're part of an organization called IEEE, Advancing Technology for Humanity. And we're interested in helping people to become more aware of health and medical device literacy today, including things having to do with cultural and linguistic diversity experienced by individuals, groups, and people locally as well as globally. And let me just say that the team is large and diverse and international, and that we are looking forward to having your participation. We were very excited to get information from you before we began today, which helped us plan our presentation. And at this moment, I'm going to turn over the beginning of the presentation to Dr. Paula Mueller, who's also a member of this organization and the team. And Dr. Mueller.
Thank you. Thank you very much for the opportunity to speak with you and share our project. So, as Keith mentioned, this is an international organization, the Institute of Electrical and Electronic Engineer, and in particularly we belong to the site or the special interest group for humanitarian technology. Um, in advance, please accept my apologies. There is some work that is being done in my house at this point, so please excuse me for the sporadic noise. To continue, this is IEEE is a non-for-profit organization dedicated to advancing innovation and technology excellence to the benefit of the humanity. And in particularly, this has its origin back to 1884 when electricity began to become a major influence in society. And more specifically, IEEE and all the inventions of the last over 100 years have been tied to New Jersey. A lot of innovation happened here with Bell Labs, the invention of the transistor, telecommunication, even going so more recently to artificial intelligence and machine learning. Everything had a root here in New Jersey, particularly in Homedale Bell Labs, where right now is Bell Works building. And but the origin of that complex was really to allocate working space for over 6,000 engineers and scientists that were working in all type of innovation that basically had its root to everything that we know in terms of uh, telecommunication and science. So our discussion today will be an introduction, discussion of medical devices and interpretation of their measure. We want to hear from you. What do you think is the future? And we want to answer all your questions. And then you will be collecting data offline that we like Dr. Like Keith mentioned to you, we ask you to gather some measurements just to have some hands-on experience. So the survey, thank you so much to all of you who responded. We got 79 responses, and basically just let me summarize the findings. All of you are familiar with medical devices. Some of you mentioned stethoscope, blood pressure, glucose meter, pulse oximeter, thermometer, but also something like X-ray machine, magnetoresonant imaging, smart scale, insulin pump, and defibrillators. Uh, all of you are aware of medical condition either from your own experience or from the ones of your loved ones. In some cases, a medical device is used to monitor or treat the condition. With respect to the languages, thank you so much for sharing that with us. We found a great variety of languages. Some of them we didn't even know which part of the world they were related to. So thank you so much for that opportunity to learn. And all of you, please the previous
Oh,
slide.
I'm sorry.
All of you mentioned that that it will be helpful if the health information is provided in multiple languages. And here I want to emphasize the need of health literacy because, like the Regina, like the general surgeon back in 2010, she said, as clinicians, what we say doesn't matter unless our patients are able to understand the information we give them well enough to use it to make good healthcare conditions. Otherwise, we didn't reach them. And that's the same as if we didn't treatment. So health literacy is very important. Please, the next one. And in particularly, we want to focus on the challenges, and we want to emphasize through this discussion today that health conditions are not just a snapshot in isolation. And that's why we want to introduce you to the concept of social determinants of health, which involve uh, e- economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. And what we were aiming to with our project is to have a real inclusion and diversity. We know that people have to participate in clinical trials because it's the only way that with inclusion and diversity, we can develop a medication and instruments, medical devices that are appropriate for everyone and are suitable for everyone to treat everyone and be effective with everyone. We know that health literacy has an impact in health outcomes. And we know that uh, very much through COVID, we realized the need of this inclusivity and diversity. Please, the next one. So our questions in this survey were pointing to basically this is one challenge. And here are some statistics for you to realize the importance of this challenge, which is associated to the lack of health literacy. In the US, we have 24 million Americans who have limited English proficiency. 26 million have vision trouble, 38 million have trouble hearing, 34 million have low English literacy skill. And we are living in a very diverse country. As pointed out by the census of 2020, the diversity index of the US is 61.1%, which if it was 100, that means everyone will be diverse. So we're very, very highly diverse country. And here are some statistics for Latinos, but it also applies to other ethnic groups, which 6 in 10 persons run into a language or cultural barrier when it relates to healthcare. And when where older adults who lives in neighborhoods where little English is spoken are at a high risk of poor health and early death. So empowerment, information, health literacy is important, and it has to accommodate the person at their um, understanding and culturally appropriate level. So what is the opportunity is to create systems that are person-centered for care. So that's what our project is, a transparent design for well-being. We want to transform COVID impact into an opportunity to advance technology for humanity. Health and medical device literacy, culturally and linguistically appropriate system, class for design and dignity, increased diversity and representation, and then in reducing bias in research, literature, and project. So with that, I'm going to lead the discussion to Dr. Albas. Thank you.
Thank you. So along with the earlier discussion about diversity and representation in terms of literature and the projects, we're also interested in understanding how we might be able to address diversity and representation in the technology in artificial intelligence and machine learning. Some of that diversity is apparent in gender, skin color, pre-existing conditions. And then as technology evolves, we're going to find that much more AI and ML is apparent because the devices aren't necessarily going to be standalone devices, but there will be IoT devices connected to the internet of things. And then there will be further analysis done using cloud computing, edge computing, and other kinds of layers of processing that necessarily has to be curated and managed effectively so that we can not only understand how diversity affects things in an individual situation or scenario or location, but also how that scales, how it transfers, how it translates, how we can help provide the best care locally as well as globally, and also considering these important diversity features of our population. So a good place to begin this discussion is to talk about homeostasis, because homeostasis is when a system is in balance. If that means a human system, you know, the biological system, but it's also other systems, the ecology, the environment, things that you build. Homeostasis is an important concept. In this case, we're going to talk about health and homeostasis, which is how we measure, how we stay in balance, and how can we measure some perturbation of that homeostasis. We find some of these instruments are useful in giving us some indication of how that biological condition is in balance or whether it's not in balance. We have a device that most of us are familiar with, which is the thermometer that measures a particular body temperature. And that body temperature has a relative normal, but it could also be not normal. It could be a fever or hypothermia, low temperature. But how does that fit in with this story? And we'll see on another slide. We have a glucose meter, which measures the byproduct of certain processes in our body, telling us what level of glucose is in our blood. And that just gives us an indication of what else is going on in our body. It doesn't tell us everything we need to know. Why are we interested in this? Because sometimes we have to measure or look at the system to find out if we've been exposed to and are being affected by bacteria or viruses. Are we fighting an infection? We want to make sure that we can understand how our autonomic nervous system is functioning and how it's affecting our circulation and respiration. One of the instruments we can use to investigate that is the blood pressure cuff. That gives us an idea about how our body blood flow and pressure of that blood flow can be measured in our peripheral system in our arm or our leg, and that tells us something about our heart or about our central nervous system and how that's responding to something that has affected us from the outside or from the inside. We're concerned about things like blood volume, fluid volume, the water that we drink. So not only are we concerned about salubrious minerals that are in the water, is our water source secure? Is it fresh water? Is it healthy water? Because our body needs a certain amount of water of a certain quality in order for the cellular regulation of ions, concentration of ions in our body. We want to be concerned about our breathing patterns, not just are we breathing at a certain rate, but how effective is our breathing? Is that providing oxygen to our blood, which then supports our organs? And we use a very simple ways of measuring certain features of that, but that's not the entire story. And of course, we're interested in whether or not our organs and our entire body is able to remove waste products and toxins. So we perform other measures to see how that part of our body is working. But our recommendation about how can we improve such a system and help people understand health and well-being now that we're challenged by managing our own health in the home or interacting with telehealth online. How can we improve the information that's available, the integration of that information, the usefulness of these devices in managing health and well-being? How can we take that to the next level? So what we decided might be a very useful way to deal with transparent design for well-being in healthcare is to take each of these individual devices, and we started with a few simple ones: the thermometer, blood pressure cuff, pulse ox, and a smart scale and a glucose meter. And we realized that each one of these devices has already a standardized identification label on it, which provides us a key into a database that's also open access. And those of you who are interested in programming and coding are familiar with this notion of open access, I'm guessing, that many people share information online, and it's really a very useful way for people to collaborate, to do like community projects or to share things that you've discovered with others in other places. And that's really the framework for what we're trying to do, both in developing this project, but also in providing that as a pipeline into future developments, such as standards. In an earlier class, people were asking us what we think about how this will be useful. Is this an individual device? Is there going to be a new device? And so we really are embracing this project because we believe that we can provide a lot of useful dialogue into a pipeline that will help develop the future. And one of the ways in which engineers do that is by developing standards that can then be shared with others. And so people who follow the standards will be able to provide something that's useful that other people all agree might be useful and that works in a particular way universally, not just locally, but also elsewhere. So here we have the thermometer. We would go into a database and we would pull up information that helps you to understand how does this temperature information fit into the homeostasis of the person? And how can we then take these measurements of the devices and integrate it into useful information and interpret that information in the context that it's being used? Okay. I'm giving you kind of a very high level point of view with a lot of different pieces of information, which are just like the tip of the iceberg into understanding how this one simple device relates to your homeostasis and to health management. So let's take the example of taking a body temperature. What is a normal body temperature? It turns out from systematic reviews of body temperature studies that began in like 1930 until very recently in 2020, that normal body temperature does range. It does vary across ages, across like where on body you're taking the temperature, and also based on your status, whether you have an impaired immune system. You may not mount a temperature. What that means to us is that by using this instrument, if you have a fever, then we can say, yes, you have a fever, there's something the matter. But if you don't have a fever, we can't rule out that you have an infection because you may be one of those people who doesn't run a fever. And so therefore, we are reminded we have to look elsewhere. We have to take all the other things into consideration, including your history, including, your environment, including your whether or not you're able to tell us about your symptoms and so forth. So another important aspect of body temperature that should be considered in this whole homeostasis is the atmospheric, the environmental temperature. And what you'll notice on the left side of the screen, we have some measures taken at different cities around the world where the environmental temperature varies. And the bar graphs at the bottom of these little these little charts, graphs, shows us how many people have died during these low environmental temperature events. And in the lower right-hand corner, we can see that we only required moderate cold in order to cause these changes in people's survival rate. And so that's a very important thing to consider, that not only is your body temperature important, but the fact that the environmental temperature is going to affect a person's ability to survive. It's going to affect your quality of life, your longevity, et cetera. These are very important things to take into consideration together. How is another, we can look at this information in a slightly different way, which is how would these measurements and environmental conditions affect children? How would they affect you in your older age? How might they affect you if you have a dementia or an immobilizing illness? So you may not be able to articulate to someone what you're experiencing. You may also, if you're immobilized, for example, you may not shiver. So if you're cold, your nervous system is not responding in a normal way. You're not shivering, and shivering actually helps you adjust to a cooler temperature in the environment. So if you have an immobilizing condition, it's difficult even for your caregiver to recognize that there's a problem. So we have to try to help people understand by increasing health literacy and device literacy to help people understand how they can help care for their loved ones or their members of their family or community who might be suffering from some dementia or immobilizing illness. Alcohol and drugs affect the way your body responds. Alcohol can impair your judgment about being able to recognize when you're not feeling well. It can interfere with drugs that you already have, so it could suppress your respiratory system. If you're in water, your skin is a conduit for heat being removed from your body, and so that can lower your core body temperature very quickly. And up in the middle, you'll see a bath thermometer, which is really a useful thing to have if you have infants or others who are not able to recognize that the temperature of the water might be inappropriate. And so the caregiver can put this bath thermometer into the bath water and make sure that the temperature of the bath water is appropriate for the health and well-being of the person who's taking the bath. You might have a thermometer in your house, a thermostat in your house that helps you understand the outdoor temperature as well as the indoor temperature and the humidity and the airflow, so that you can help provide a very good environment for people who are compromised. And at the lower right-hand corner, you see an article, a graph from the article by Potter, who does military work. They look at how people are dressed when they're doing duty in the military, when they're doing certain kinds of activities, when they have a certain environment that they're functioning within. Are they firefighters? Are they in a submarine fighting a fire? These are all very important things to know in order to predict when the person might be having a challenge, a physical challenge that will affect their health, so that you can protect them from the consequences of those physical challenges. And that's a very big area of research. It also ties in those IoT devices that are connected to a network, so that someone in another location can manage those workers who are in a military setting or that are in a firefighting setting and help inform them, these conditions are severe. You must leave that environment, either send in a replacement or just leave this environment because it's too extreme for people to be in there fighting that fire. That's the time when you call in the robots or some other support infrastructure. So these are very relevant to our discussion of homeostasis and engineering, and not just biomedical, but also other areas of engineering that you might be interested in. So here's a very important article the FDA pointed to, notifying everyone about how certain devices are not what we call fit for duty. And many people during the pandemic are using pulse oximeter devices, putting a little pulse oximeter on their finger, monitoring themselves at home to determine whether they have a sufficient blood circulation of oxygen. And it turns out in this chart in the middle, you can see in the gray area, the individual measurements of people who are white persons versus Black persons when they took a blood oxygen level. That's the gold standard for determining whether a person has enough oxygen in their blood. It's a blood test that's done from an arterial source, and they look to see what the blood oxygen level is there. The Pulse Ox device is the bar and whiskers chart above it. And you can see that in the case of Black people, the bar and whiskers chart was completely not accurate for this purpose. And many people were far deprived of oxygen before realizing they had an emergency and needed to go to the hospital. And so in the last paragraph of this article, they point out how important it is to consider all the other symptoms and context of the person's background and their physical condition. Pulse Ox device was never meant to be the only device used, but in this case with pandemic, we find that we're managing our own healthcare at home and supplementing that with telemedicine. And so we believe that our project and our effort and our new standards will help us shape a future that's a bit more transparent to promote well-being. So another effort within that domain, we're looking at how we can take objective measures from other areas of engineering and apply them more holistically in other fields. So we'd like to create a standard where we use other measures that have been already determined for things like television, camera design, and then bring them into the healthcare so that you don't get horrible stories about how recognition systems, AI systems are grossly overestimating, poorly identifying people because of their skin color or other things that maybe we can introduce in a much better way into the standards in this domain. Another example of an article that addresses the subject, it's very important article and it's very relevant article, but it's very specific. This particular article looks at certain races, certain skin color, and it applies to creating prosthetics in a certain local area. People in that area have certain skin colors, so the company making the prosthetics might be concerned about those skin colors, but one cannot look at this article and then apply it generally and broadly elsewhere. So it's important to understand when you have data and then you try to use that data for some other purpose, whether that data is helpful. So curating the data and making sure the data is appropriate for your use is an important thing that we'd like to also help create some standards around, at least some discussion around this, and raise the awareness in many channels like publications, in conferences and so forth. So now, if you have any questions that you'd like to ask, we would be excited to hear them. Hmm. Christine, do you have any questions? Any students have any questions?
I'm trying to see that right now. I have one.
Ah, excellent. Oh, wonderful.
She's
Wonderful.
gonna mute and put her camera on. Go ahead, Leah.
Fantastic.
You showed an example of like the coloring of prosthetics.
Yes.
I'm not really sure why the color, I'm not sure why the color of prosthetics is like such an important part to people. Is it because they want it to look like a limb that they don't have?
Yes, I think many people are concerned. For example, recently there was a lot about Crayola crayons having the right colors in the box, and about Band-Aids being, more diverse so that people could put on a plaster after receiving sutures or vaccination.
In Europe.
Yes,
The Band-Aid.
and yes. So what they call a Band-Aid a plaster. A Band-Aid is a trademark name or a product name, but in other parts of the world they have different names for these things. And so people really would like to feel included. They don't want to feel like they have to put on a color that was made for that represented a population other than the one they belong to. That's a very good question. Mm-hmm. Yeah. Yeah, and then there's even more subtle reasons. So if you're making dental prosthetics, for example, the color of the teeth, yeah,
Because it
varies.
would be weird if like you have, wait, is it echoing? It would be weird if you had like all your teeth like pearly white and then you have like this one yellow prosthetic tooth.
Exactly. Or even if the tooth, like our natural teeth, have a color gradation from the top all the way down, and some of it's translucent. So when the light hits it, it behaves differently, more like a pearl, right? So as time goes on, I would really love to see people take like the Mikimoto pearl philosophy, carve the tooth like they do a mother of pearl when they make cultured pearls, and then grow teeth out of the same way that they make a cultured pearl, because that biotin that's part of the pearl is a little bit more compatible with the way teeth look than the plastics that we use these days. Or yes. So I think these fields are wide open for creative development, for new solutions. Another question? Someone's pointing. You're gesturing over there, Christine.
I
I
was
wasn't
telling her
sure.
to mute, so it wasn't. Okay.
I see. Okay. I'm sorry.
All right,
Yeah.
next
So
question. Anybody or no? We have a question about is Dr. Muller still there?
yes.
Yes, yes, I am here. I'm sorry, I'm muting because of the noise of the
No,
background.
it's okay. So how did you get into science, and were there any specific people that inspired you in your past?
Say that again, excuse me.
Were there any specific people that inspired you in your past, and how did you get into science and find your love for science?
Oh, thank you for the question. Yes, I had a lot of mentors along the way, but the beginning was I love from school math, physics, and all of that. So I'm originally from Chile in South America. So when we start just we had at that time very few options, either law, medicine, architecture, or engineering, and those sort of by I thought, well, I'm going to go into engineering and I'm going to figure out what I want to do at the end. But then early on, I discovered the field of biomedical engineering, and that set really my path, because in order to achieve biomedical engineering, which is the use of engineering in the medical field, um, that really merged my passion for healthcare and engineering. But the bottom line is that in order to achieve biomedical engineering, I had to go through electrical engineering. And that's how I did that to begin with. And that gave me all the tools to sort of have like a kid, a broad spectrum of possibilities what you can do. And then life take different paths. So I did have a lot of mentors. One of them was my mentor at Rutgers University, where I did my PhD. And she was a wonderful, wonderful professor. And we had very interesting, what was interesting for working with her is that not only she was very human and nurturing, but also we had very wonderful intellectual discussions, and that's what made her such a wonderful mentor, guide, and friend. And the same thing links us with Kit, that we had friendship, but also we are collaborators, and we are connected at a very basically always coming up with new ideas, new solutions to problems. So the intellectual discussions are the ones that that bond us together. So yes, thank you for the question. I hope I gave a long answer to her question.
Yes, what you'll notice is our team grows that way too. So our team grows like we reach out, we meet these new people, so many exciting things. And, many people on the team that you see on our first slide and that you'll see in our publications and other discussion groups. We're not just engineers. We live it. We're friends. We learn from each other. We're mentors to each other. One day I said, hey, I have this plot to take over the planet. Can you help, and or do you know somebody who's interested, and it's a lively discussion for life, and I hope other people on this group will see that from us, how much we enjoy what we do and how that provides us with an opportunity to communicate with one another about something we care about.
And what was your path like, Kit?
Yes, non-traditional and traditional at the same time. So I grew up in New York City. My dad was an electrical engineer, graduated from Manhattan College in electrical engineering, but did everything. He wasn't just an engineer. He, at an early age, his dad died, and so he took over the family business, and there were many jobs and many things, but always he spoke from the voice of an engineer. And so that was always in my ear growing up. And I didn't realize it. Because by the time I got to the age where it was time to go to school, to college, my father said, you go to college? What makes you think you can go to college? So it was this sort of a surprise. And it took me many years to actually find my way into engineering again, and not not unsurprisingly, it took me a long time to get into Bell Labs. But I learned about Bell Labs because I was a headhunter for a while. I was running a school program, adolescent vocational educate exploration. I was a teacher. I did all kinds of things. And as a headhunter, I began recruiting people at Bell Labs, and I thought, wow, these people do some fun things, very interesting. And I thought, but I want to do that. And somehow, like, I don't know, luck, stars, I was fortunate enough to get recruited into a job there, and it was the best thing in my life. I got to learn so many things, work with amazing people, learn about this notion of mentoring, and then the story just continues. And with IEEE, you can continue that through your life. And when you can volunteer, you can then take the part of the engineering that you enjoy and expand on it and bring your own teams together, which is really great because you don't have to end when you finish your job at a particular place. You can continue that discussion for your entire life. So it is a very rewarding opportunity to be involved with engineering and this IEEE group.
Any other questions? I'm just gonna check my phone because the kids are at the other school too.
Ah,
And see if they've messaged and said questions. And we have a similar one about like the accuracy, right? And the best way then to get care for elder people this time they're asking. Like, are there any specific instrumentation, I guess, that they should be using that they didn't know to use?
yes, that's a really good question. Dr. Mueller and I we spend a lot of time thinking about this particular question because in her business, she addresses elders. And Dr. Mueller, do you want to speak about that for a moment?
Yes, actually, a very, very important point with the elderly, like just to be aware of the sensitivity of their system, just the concept of homeostasis, like like Kid was talking about. They have a very sensitive system. As we age, the way that we can compensate and maintain this homeostasis, it becomes more challenging. So being very aware that any change, and then we add it with the chronic conditions that they may have. So fluid, for example, very important that they get enough fluid, like the kid was describing. The changes in temperature, our bodies change as we age, so we don't produce the same responses like when we were younger. So temperature changes. Usually the level of temperature are colder, so are lower. So what in younger ages is described as fever, it may not be the same for older adults. The way that we transpire when we are hot, they don't transpire as much either. So just be aware of the changes as we
Right.
age.
Don't wait
And
until the person has a fever. When they're older, I've noticed that some people are using this, oh, wait till the person has a fever of 101 or 102 before you call the doctor. That's really just not appropriate for older people. If they feel poorly or they're behaving differently, if they're unaware or, if you can see they're complaining to you or they're coughing or something like this, go to call the doctor. Don't wait till they're running a fever.
yeah,
That's
yeah.
really the important message here.
Very important, the change in behaviors. Any change that you observe, it may be the manifestation of a disease. So yes, observe them very much. Thank you.
Thank
Thank you
you,
for the
guys.
question.
I
Yes.
know on my end, I have a break and then I see you again the period after that. I'm not sure.
Yes, so do us a favor and do your assignment and send us the data and we'll analyze it and get back to you. Does that sound good to you?
I converted the Excel sheet to a Google sheet, so I'm just gonna share that with you.
Wonderful. Thank you so much.
Yep, bye.
Cheers.
Bye.
Martha is with us. Okay.